I'm Dr. Natalie McKee at Bloomington-Normal Audiology, and welcome to I Hear You, where the audiologists at B&A answer your hearing-related questions. Austin in Normal asks, I've been told I'm a loud talker. Could this mean I have hearing loss? We get this question a lot, and it is one of the reasons that people schedule appointments for hearing exams. Some people will be loud talkers due to the circumstances of how they were raised. We anecdotally have patients tell us, well, I grew up with 5 or 6 siblings, and I had to be loud if I was going to be heard and get my point across. So some of us naturally come up being louder talkers or end up in professions where we learn to talk loud, like audiology, but also teachers, public speakers, salesmen, people that have to be up in front of people. And those people sometimes can turn it off and on, where they know that they need to be louder for the situation and then they go home and they have their inside voice. But there are people who will, with hearing loss, they don't realize the volume of their own speaking, and as their hearing loss increases, they will gradually get louder and louder. This will happen to people of any age. So we will see little kids sometimes come in and parents will say, everything was fine, and then all of a sudden the TV needs to be louder and they're screaming about everything all of the time. And they end up having an ear infection or fluid. They get that treated and then their volume goes back down. The same thing happens with hearing aids typically. The patient can't regulate themselves well. You get amplification, bring everything back up to where it should be, and they now hear themselves better, and then that is just a self-regulation of bringing themselves back down. It sometimes takes a little time to get back down to normal, depending on how long it's been, but that's something that we work through with patients if that does end up being the cause of the problem. So if you're concerned about the volume of your speech and think maybe you have a hearing loss, it's a good reason to come in for a baseline, and we'd love to see you for that. So I hope that helps. If you have more questions, be sure to reach out to us. I'm Dr. Natalie McKee from Bloomington-Normal Audiology, and we are here for you.